A lot of times when I'm working with a person on their upper body and a lot of tension in the upper body, at the end of the session they'll say, Dr. Russ, what can I do to keep this from happening again? Are there particular stretches I need to do? Do I need to strengthen my middle back? And I say, probably breath work. Let's get your ribs moving. Let's get your shoulders moving with manual therapy, and let's keep them moving with breath work. So maybe I sent you this video because you're a patient of mine and we just had this discussion today. So welcome. I hope you do this, and I hope you come back to it as often as you need to in order to keep yourself feeling good and mobile and limber and open and relaxed and comfortable through your neck, your shoulders, and your whole upper body. We're going to key into our breathing first. We're going to sit here and breathe. We're sitting forward on our chair a little bit so that the back and the arms are not in our way as we move our arms around, as we're going to do some movement of our shoulders. And you can see I'm breathing kind of up into my chest. Deliberately lifting my chest, especially my sternum, my breastbone, with the in-breath. Imagining that sternum is like a cork, floating on your breath and just kind of really gently sinking as your breath is like a wave. Your breath comes in, your sternum floats up, it's buoyant. And as you breathe out, your sternum just gently kind of sinks down with the surface of the water. Like that. And let's key into how when we take a big chest breath, the chest expands forward in the forward to back dimension. More forward than back, but a little bit back too. So take a nice deep breath up into your chest and feel the breath coming into the upper back. And feel the breath coming into the upper chest. And it's nice at this point with the in-breath to really deliberately lift the chest and even kind of like round the back a little bit. Really kind of like work and finagle that breath up into the corners of your upper back. Keep doing that. We hear a lot about belly breathing and how diaphragmatic breathing and belly breathing is relaxing to the nervous system, and that's true. But we also want to be able to breathe into our rib cage. Today we're going to do both. And since most people are carrying most of the tension through the upper back and the upper ribs, that's where I want to start, by getting some movement through there. The in-breath is where the effort is. We're going to put forth the effort to open the rib cage front to back as we breathe in, and the out-breath is passive at this point. Just like let the elasticity of the rib cage and the elasticity of the lungs and the elasticity of all the upper body musculature just kind of push the breath out for you. So the in-breath is effort, and the out-breath is a relaxed state. You're not pushing out the breath. We're going to move the attention of our breath now down to the middle and lower ribs. And those are going to want to expand to the side. So again, breathing in is effort. Feeling the sides of your body opening and really kind of like using your muscles to open that up a little bit for yourself. And then the out-breath is just passive. Putting your hands on the side of your body here like this and feeling the rib cage doing this as you breathe in. The ribs are moving to the side, but it's also all the ribs are kind of fanning open. You see how my fingers are opening? And then as you breathe out, the natural elasticity of the rib cage, of the diaphragm, and the intercostal muscles just gently pushes the breath out. Breathing in, expanding to the side, breathing out, just relax, and everything just naturally gets pushed out. One more time. We're going to combine the two now. We're going to breathe into the side and the lower ribs, and then we're going to continue the breath and expand the chest and the upper back front to back. So it's like breathing into the middle ribs, breathing into the upper ribs, and then the rib cage just recoils. It pushes the breath out for you. One more time. Breathing into the side ribs, Breathing into the front and back on the upper ribs. And then relaxing. Let's do that again. Now let's take our hands and find this inverted V here, right at the bottom of the sternum where our ribs come together right here. And as you breathe in, I want you to take your fingers and expand that V. And as you breathe out, let that V contract. So it goes from a V like this with the in-breath, a V like that, and then the out-breath like this. So with our fingers, we're actually really kind of catching those lower ribs. We call that the costal margin. And pull them apart a little bit, gently. You know, you can do it firmly. You're not going to hurt yourself. So we're just kind of self-mobilizing the lower rib cage. And you can see there's effort in my shoulders. One more time. Next, we're going to take some big deep breaths, and as we do, we're going to lift the shoulder blades with the in-breath and then let the shoulder blades depress with the out-breath. So this is not our natural state of breathing going through the day. We're exaggerating the little micro movements that happen with our breath so that the micro movements get easier, okay? So we're going to breathe into our upper chest that expands front to back, and while we do, we're going to lift our shoulder blades up. So it's like this. And again, on the out-breath, everything relaxes and recoils and pushes the air out. There's no need to put any effort into the out-breath just yet. Breathing in. In-breath, front to back, expand. Shoulders up, and the out-breath, everything relaxes. Shoulders descend, chest relaxes, abdomen and diaphragm are relaxed now. Let's do that again. On the in-breath now, we lift the shoulders again and pull them back. Squeeze the shoulder blades together and then relax everything on the out-breath. As you feel, as you're breathing in, lift the shoulders, shoulder blades come back. As they do, the sternum naturally kind of lifts up and the upper back arches a little bit. We're going to work with that. On that in-breath, as the shoulders come up and then back, see if you can sense some separation between the shoulder blade and the back side of the rib cage, and a little arch. Get a little arch. Try and get it way up into your middle back if you can. And then on the out-breath, all that relaxes. Let's do one more of those. Breathe in, lift the shoulder blades up. Bring them back. Arch your back a little bit. Get some separation between the spine and the shoulder blades. Get that arch as high up into your upper back as you can. And then on the out-breath, just relax. If when you're doing that and the effort brings any sense of cramping or spasming into your upper back, then just back off a little bit. There's no need to push through pain when we do this. Let's just check in now with some big breaths and see if you can sense the fluidity of your breath now that we've opened up those rib joints, stretched our intercostal muscles. Just see if that feels any freer for you. It sure does for me. Now let's think about from the top of your head coming up into the sky, right? There's a big, very strong cable and you're hanging from it. So getting some elongation through the neck and allowing the shoulders to descend and just allowing yourself to be as long and tall on your seat as you possibly can. See how long your neck can be and the shoulders just want to descend. And now as we're focusing on length through the neck and length through the torso, let's do some more front to back, upper back breathing or the sternal breathing. And what we want to do is make sure that we know how to breathe without neck effort. And so as we're just dangling from the top of our head and our neck is long and relaxed, these muscles here, the scalene muscles, are relaxed. These muscles here, the sternocleidomastoid muscles, are relaxed. And we're going to keep that sense of relaxation through the neck as we breathe deeply into the chest. Notice that there is a tendency, as you take a nice big chest breath, to kind of turtle your head down. And that's what we're trying to undo, that tendency. So the neck stays long. The back of the neck is long, front of the neck is long, the jaw is relaxed, maybe even your mouth is slightly open as you're breathing deeply into the chest. And as always, our out-breath is just a relaxed, passive recoil of the tissues in the thorax. And let's see if we can keep the sense of long, relaxed neck as we breathe deeper down into the rib cage. So again, those side ribs opening, and then elasticity recoiling. Breathing into the middle and lower ribs, expanding the body side to side, fanning open those side ribs, while the neck stays long and relaxed, and the shoulders stay down. A few minutes ago, we practiced lifting the shoulders with the in-breath, freeing up the scapula with the in-breath. Now we're practicing, can we keep the scapula where they are and let the rib cage move underneath it? So our shoulders stay down, our necks stay long. We're breathing deeply, really deeply into the side body, in, and the out breath is just a gentle, passive recoil. Now let's see if we can practice some gentle belly breaths. We don't need to expand our abdomen unnaturally, but what we want to do is just see, can we take a breath in with minimal movement of the rib cage? And the rib cage is moving minimally, not because we're holding those muscles tight, but because we're allowing the breath to sink down into the abdomen. There's always going to be some movement of the rib cage with every breath. But let's see if we can key into the elasticity of the abdominal tissue and the abdominal muscle. This is challenging when you're sitting. You might find this easier when you're laying down. If you want to pause the video now so you can lie down, please do. I'll still be here when you come back. Sensing that diaphragm deep in the core of your body, descending with the in-breath. Literally pulling the air in through the airway into the lungs, and then just the natural elasticity of the diaphragm recoils and allows the breath to flow out. Breathing in, pulling that diaphragm down into the belly. The abdominal tissues expand in whatever direction they want to expand. And then as you breathe out, it all recoils, comes back up, and the breath gently pushes out. Air is like fluid. It really is. It behaves like fluid. And see if you can get a sense now of how with that in-breath, it's almost like someone is pouring the breath down your airway, and it just sinks all the way down into your abdomen and grounds you into your body so beautifully and effectively. It's so calming. Out breath. Beautifully done. That was some really nice belly breathing. Let's try something new now. What we want to do, keep our airway open and keep everything as relaxed as possible through the chest, the rib cage, and the abdomen. We're not holding our breath, but we're just going to wait for the body to breathe us in. So we're consciously breathing, but without any effort. It's a little paradoxical. Holding your airway open, keeping your body relaxed, and you'll see that your body will breathe in. And it'll be exactly the kind of breath that you need right now because you're just letting your body do it. This is a truly fluid, natural, almost effortless breathing. We're still keeping our neck long. Boy, are the shoulders relaxed right now. I can hear it in my own voice how relaxed I am. Really well done. Really well done. Let's just finish up with some gentle upper body massaging and opening, keeping those shoulders relaxed, staying with the breath, massaging the palms, opening the fingers, getting in the web here between all of our fingers and thumb. Feels really good. Lots of amazing acupuncture points in here for the lung. And open the palm, keep breathing, close the palm. So now we're practicing moving our upper body while keeping our breath relaxed. Gently massaging the forearms. We need to be able to keep ourselves in a relaxed breathing state while we're moving through the world. So we're just practicing simple movement, and while we're doing it, why don't we take nice care of ourselves? Just rubbing the arms, a gentle squeeze, feeling your muscle tissue, feeling the bone deep in there. Our arms and hands doing so much for us. Good. Thanks for doing this little breath work with me. I hope this helps. I hope your neck and shoulders are super relaxed, and I hope you come back to this video as often as you need to remind yourself and practice how to breathe. Dr. Russ out.